My case study is Ted. He is a 7-year-old boy who was diagnosed with Williams syndrome not long after birth. His parents are concerned about his inappropriate social skills and difficulties with successful completion of his morning ADL routines. Two strengths that we can expect for Ted to have are being highly social and having a good ability to learn new skills by repetition. O'Brien and Miller-Kohunik teach us that being highly social is a strength that can be capitalized on by those diagnosed with Williams syndrome, and that they also generally have a good ability to learn new skills by repetition. Two reasonable concerns that we can expect to have concerning Ted are appropriate social skills and being able to successfully complete basic ADLs. While being outgoing is a strength, those with Williams syndrome have a distinctive outgoing personality that can also lead to social vulnerability. Also, the notable trait of hypersociability combined with a lack of social skills can lead to poor social outcomes, resulting in feelings of loneliness. Poor visual spatial skills is a common impairment in those diagnosed with Williams syndrome, many times making successful completion of ADLs and IADLs difficult. Three underlying factors and characteristics of this diagnosis that need to be addressed during the assessment and intervention plan are visual spatial skills, bilateral coordination, and social participation. It is important for social participation to be addressed because hypersociability doesn't always translate to appropriate social interactions, which can lead to isolation and loneliness. Motor development, such as grasping, fine motor skills, and bilateral coordination, are the fundamentals of child development that are prerequisites to our daily occupational performance. Visual spatial skills will need to be addressed to see if Ted's difficulty with successful completion of his morning ADLs is due to a visual spatial issue. Fisher et al. Inform us that poor visual spatial skills is common in those diagnosed with Williams syndrome. Two frames of references that would be appropriate for this case. One, the behavioral, to teach and reinforce positive social interactions, and two, developmental, to address the array of developmental delays that are possible with this syndrome. These include fine and gross motor, social, emotional, and cognitive components. The two assessments that I chose to use with this diagnosis are the PDCAT and the PDMS. The PDCAT is a top-down assessment, and it is good for birth to 20 years of age and looks at the child's ability to perform functional everyday skills. It is a good measure of progress, and this assessment involves a caregiver filling out a questionnaire. This test has high test-retest reliability and validity, which will be good for reassessing to measure progress. The PDMS is a bottom-up assessment, and I chose it because it covers 6 domains of motor development that are important for a child to have for their successful participation in daily occupational demands. I predict that in time, Ted will be successful with improved social interactions due to the probability he will be able to learn new things well enough by repetition and practice. Once all visual and motor issues are identified and addressed accordingly, I feel that Ted will become successful in completing his morning ADL routine. This may include adaptations to the task or environment and/or possibly cueing. The best interventions can be established once all underlying factors that are contributing to his ADL difficulties has been identified. Two close goals for Ted. The first one is Ted will appropriately respond to others' 3 out of 5 trials without cueing for 3 consecutive weeks in 6 months. The second one is Ted will complete getting dressed and brushing his teeth by following a picture chart with only 1 verbal prompt to look at chart after eating breakfast 4 out of 5 school days for 2 consecutive weeks within 3 months. To measure the progress of goals, I will re-administer the PDCAT at the 3-month mark to assess ADL goals and ask the mother and teacher to track social interactions. I will provide both the teacher and the parent with easy charts that only require a check mark for documenting whether interactions are positive or negative. Stay tuned. The intervention plan will be revealed in OTH 5519.